Hello, if you're looking for a hair transplant and you have a confusion around ads, prices, promises, what are the reason you should be doing a hair transplant? I think this video is for you. I'm going to cover the reason for hair fall, also educate the people whether you should be doing a hair transplant or the medical treatment is good enough for you, the cost of the hair transplant, possible recovery time, and the complications around the hair transplant. So do stick around till the last if you are interested really knowing about depth of the things in the field of the hair transplant. Now, what is causing the hair fall? What is the reason for hair fall? As we rightly understand, majority of the patients when they come to us, male patients, androgenetic alopecia or the male pattern hair loss is affecting the 90% of them. It is other 10% or 20% of the population where we see the nutritional deficiency, a stress-related hair fall, telogen effluvium, post-illness hair loss, or some sort of a hormonal fluctuation, or some sort of a scarring or infection on the top. 90% of the patients who loses the hair, it is because of the male androgenetic alopecia. There is a hormone in your body we call testosterone. Testosterone is getting converted to dihydrotestosterone. DHT is an active form. And why it is converted? Because of the action of the alpha reductase enzyme. When we see the DHT is not a bad hormone, but at the sensitivity and the skin or the peripheral tissue level, it is so on a higher side. So what does it do? It helps reducing the cell proliferation. Sometimes it affects the blood flow, and you tend to see the miniaturization sets in and the hairline and at the crown area. Gradually in grade 3 and 4, you start seeing the hairline is receded, the crown area is widening, and the area is merging. In grade 5 and 6, the entire top of the head is going to get vanished. Grade 7 is an established baldness on the top of the head. So DHT is the hormone which causes the thinning of the hair and reduces the blood flow at the top, and at the back of the head area the DHT action is not there. That's why majority of the patient you see the receding and the loss of the hair on the top. Nothing happens at the back of the head area. When do you consider the medical approach and when do you think about the transplant? When we talk about early onset of the hair fall, grade 1 and 2 specifically, where the thinning of the hair has started and a bit of miniaturization is seen, your scalp may be seen under the light. So in such scenario, we educate patients. You can think about minoxidil solution. This is simply a vasodilator. Stimulation of the blood flow happens at the root area and you start seeing some sort of a stability in the hair fall. These are the patients who should be looking for a non-surgical thing. Even the finasteride tablet and a dutasteride tablet helps in certain cases. Some of the times in early onset, we add PRP treatment, GFC treatment, exosome therapy, even the low laser light therapy. There are fancy injections of dutasteride, mesotherapy, peptides are available in the market. These days, there's a lot of buzz around the exosomes also. So these are the non-surgical thing mainly used for grade 1, grade 2, sometimes at early grade 3, Norwood and Hamilton staging. If we are thinking about the hair fall, early stage, the non-surgical things so well. So when do you do the transplant? Anything beyond grade 3B, we talk about transplant. 3B to grade 7. These are the classical candidate for the hair transplant. You can harvest the graft from the back of the head area and implant on the top of the head area. Not necessarily everyone is a candidate for the hair transplant. Sometimes what happens, the donor area is depleted. So grade 7 with a poor donor area, we don't do the surgery. But in the same case, if we have the good beard area, good chest hair, good other body part hair, we can harvest the graft from the other body part and then implant them and ensure that given grade 7 hair loss is tackled very successfully. We also need to consider which are the patients who should be looking for a transplant. As I told you, not only the staging of the hair loss is important, but the age of the patient is also important. Age of the patient, anyone between age group 22 to 65, 67 is a good candidate. Why younger patients we don't recruit them for the transplant? Because when we talk about the younger patient, the testosterone is on a higher side, DHT is on a higher side. So most likely, if we end up doing the hairline correction in 2 to 3 years, they come back with a crown area involvement. So early 20s, sometimes we are cautious, patients are not carefully counseled, patients are not motivated to take the medical approach, they are not a good candidate for the hair transplant. So age limitation is sometimes we consider older the individuals beyond 65, 68, sometimes the donor is not strong enough, or sometimes we understand the survival of the graft is not good enough. That's why we tend to reject such patients. Sometimes even the coexisting medical condition like uncontrolled diabetes, hypertension, and thyroid is also not allowing us, limiting us to do the procedure. So these are the consideration when we talk about the hair transplant. Sometimes we don't also recruit patients with an active scarring alopecia on the top of the head area. Now there are different diseases that comes under the scarring alopecia, like discoid lupus erythematosus, SLE, pseudopelludoprop, lichen planus. These are the diseases which is slowly increasing in size. Generally, the hair loss happens in patch, and there's an inflammation beneath the skin. So even if you do the transplant, the graft will not be accepted. It will be easily displaced. So what are the consideration? All in all, if patient is looking for a transplant, these are the thing we consider: age between 22 to 68, donor area has to be good enough, the recipient site should not have scarring and infection, the blood report should be within range. The blood report typically involves the viral markers clearing, which is hepatitis B, C, and HIV. We also check patients' bleeding time and clotting time, so we don't see the intraoperative lot of bleeding. So these are the 3 or 4 considerations before anyone is looking for a transplant. Now, what are the types of hair transplant? Patient must be thinking, I think I should be doing this transplant, I should be that transplant. But largely speaking, it is an FUT versus FUE. FUT is where the follicular unit transplantation happens. The entire strip is removed from the back of the head area. The graft are divided into small pieces and they are precisely placed at the top area. Because of the fact initially there were no instruments available, FUT was more popular. Now the FUE has taken over largely in entire field of the hair transplant. Majority of the doctors, almost all the doctors, are doing FUE procedures. Some of them are doing the combination treatment, but most of the doctors are doing the FUE procedure. I'll be very honest with you. When it comes to naming the fancy technology like Sapphire FUE, like a biostimulated FUE, DHI, micro FUE, or any fancy name that you want to stick on the patient face, this is generally to woo patient. This is generally to recruit the patient. It is not the fancy instrument that gives the result. It is the skill of a doctor that is going to give you the result. So I would rather say that FUE is going to be the procedure, even though we also use certain terminologies to simplify the patient's interest. But if you go to a doctor and do consult him, I would say, show me your results, show me 50 cases, show me 100 cases where the hairline is looking natural, the where volume on the top of the head is good, and where the donor area recovery is excellent. These are the key marker. This is how, as a patient, you should be evaluating a clinic or a hair transplant doctor. But in order to simplify, what are the techniques that has been used? Over the period of time, FUE has seen immense change in sizes of the punch. Initially, it was 2 mm or 1 mm punch. Nowadays, the punch sizes for the graft harvesting has gone down to 0.8, 0.7 mm. The diameter of the punch is so small. So when we harvest the graft, the surrounding tissue healing is so well. You will see completely normal recovery from the donor area. You can even harvest the chest hair, beard hair without having significant or the minimal scarring. So that's why the harvesting has gone superior and superior, which initially was 4,000 was the upper limit for the harvesting. Nowadays, there are clinics who are doing 6,000, 7,000 graft to cover the entire head. So harvesting device in FUE has improved a lot. Similarly, the implantation devices have also improved a lot. Initially, people were doing the needle implantation. Later on, they have replaced with a Choi implanter, Keep implanter, and a fancy implanters have come in the market. These days, also people use the Sapphire slate maker. The implanter devices are based on the skill of the doctor, comfort of the doctor, and expertise of the doctor. It is not one is superior over the other. So if you're doing one craft over the period of time, you become very good at it. So I would not rate one technique is superior over the other. I would rather say the skill has to be the paramount important. The result of the patient, the hairline of the patient has to be the most important thing when you decide which hair transplant technique you should be choosing. In fact, I would say patients are not the one who should be choosing the technique. In fact, the doctor should be choosing the technique which is more comfortable to them. I'll be talking about the result timeline. So what happens when you do the transplant? Typically for 7 days, you end up seeing the graft is growing properly, the hair is accepted nicely, the crust is falling, and you'll start seeing the sprouting of the new hair. But the new hair, the happiness will be lasting very short time. Within 1 or 2 weeks, you'll start seeing the shedding of the hair. The implanted hair follicle grows for some time, then it falls. Sometimes we see 70 to 90% of the hair follicle falls in first 2 months, and 3 months onward, you'll start seeing the regrowth. So typically 3 to 4 months, 20% of the result, 6-8 months, 50% of the result, and up to 1 year, you'll be able to see the 100% of the result. When it comes to transplant, it is a long game. It is like a pregnancy. You don't expect something to happen in 5 months or 6 months. You expect a baby to be delivered at 9 months. Similarly, a hair transplant journey is always for 8 to 12 months. You cannot expect the 3 month or 4 month of the result. You need to educate all the patients when they come for the consultation. It is not a journey of days or weeks, it is a journey for months. What are the do's and don'ts? I think typically I would be saying you should be very careful for first 7-10 days, spraying the saline in the top area, cleaning the donor area with betadine solution, and overall keeping it very light. Don't go for the heavy exercise, heavy gym session, or go for the running and all. Let it heal properly, then you can resume your routine work around 10 to 14 days. This is the good takeaway. Long-term approach with medical approach, which is so important, because the hair loss is progressive condition. Sometimes people are being, driven with the fact that, oh, we do the transplant in a way that we don't need to do the medical approach. If we do the transplant in the front area, the area behind it are exposed to hormone, exposed to stress, and you may eventually lose the remaining hair. So how do you ensure that the transplant result is lasting long term? So we need to do a good transplant followed by a good medical approach. Definitely, if you do consult to doctor, he will give you the options of topical minoxidil, oral minoxidil. He will give you the options of topical finasteride, oral finasteride, oral dutasteride, sometimes the PRP, GFC, and exosome therapy. I would say transplant is not one time thing, it is a long journey. So if you do it right, it becomes a one-time thing and you can maintain definitely for a couple of decades. We need to ensure that good transplant followed by a good medical approach, it is the holistic thing, not just only transplant. I would say many times people are being missold that transplant has to be done once and nothing else to be done. It is a sales tactic rather than an honest opinion from a doctor. Hopefully this video is informative to you. I tried to cover the reason for hair fall, the types of hair transplant, what to expect post-care. I think in later videos we'll try to cover the cost of the transplant. If you like this video, you can share with your friends. You can also comment some of the things you like, which are the videos you want to share in the future. I'm Dr. Malay Mehta, cosmetic dermatologist and a hair transplant surgeon from Mumbai.